Good afternoon. Today we'll be going over some things regarding the Springfield General Hospital and the current direction we as a management group want to go. So today we'll be discussing the problem a little bit, and as you know, one of the major problems for hospitals in general, and especially Springfield, is that we have a huge issue with prescribing errors, confusion over drugs with similar names. We have issues with inadequate attention to the synergistic efforts on multiple drugs and patient allergies. This usually happens when you mix different drugs and don't know that one drug can affect another. And then, of course, some of the other ones that have to do specifically with our staff at Springfield is that the handwriting identification is hard to read, or you cannot understand exactly what medication has been prescribed, or that it's so poor and ineligible we prescribe the wrong dosages or even the wrong drugs. And because of these errors, those and other related errors have contributed to more than 770,000 patients annually in U.S. hospitals that have either been harmed further and or possibly death. And of course, in relation to these type of issues, it adds healthcare cost alone. So this is a negative bottom line effect to our business, and of course the main goal is to help our patients. So we definitely have a problem here that we need to change. So the understanding the need for the change here is that we need to lower overall incidence of mismanagement of prescriptions and the health of the hospital patients. I mean, that should be the key goal for both the doctor, the nurse, and the patient themselves. And of course, we want to lower the overall cost for healthcare involving wrong prescriptions or doses based on written error. The more drugs and prescriptions and times at the hospital is only going to drive healthcare higher. So lower overall cost for the hospital and the healthcare industry is only a benefit for both the hospital and the patients. So some of the next steps we as a management group need to look at is we need to study new technology with vendors and current doctors and nurses, and then trial the different systems Springfield has chosen. We will have dedicated dates for these vendors to come in and present their systems to us. And then after a vendor is chosen by the consensus, us as a management group, we will work with that vendor closely on tailoring to our specific needs for Springfield General. This is making sure that patients' names and their dosages and their medications, their surgeries, everything is tracked the way we need it and the way we need to see it. We need to make sure that we have subject matter experts that work with the vendor so that we understand what their system is showing us, and then make sure their system's needs meet what our day-to-day business is. What a nurse sees versus what a doctor sees versus what management sees may all be different, and we need to make sure that we're all on the same page when regarding this new vendor system. So one of the major takeaways here is I want everybody to understand is that we as a management group need to ensure that our team members understand the current state existing problem, and that this is a new step to help our hospital, and that we're not trying to force a new system on them just because. So again, if we go back to the previous slide of the problem, we need to make sure that the employees, and especially the patients as well that we're working on, that this new system is there to help everybody get better. So some of the next steps is once a vendor in Springfield have agreed upon final state of the new software, we need to work on a future training schedule of the employees. We need to make sure all employees go through the training for this new software. And then we need to start small pilot teams with the subject matter experts. We need to do this for a couple of reasons. We don't want to make sure that we're just forcing a mass change on the hospital all at once. We would like to gather some feedback from the employees. It's very critical that you as managers get feedback from your groups, from the doctors, from the nurses, from billing, from the different aspects of the pharmacy, to make sure that what we've set up is in fact doing what they need it to do for their business. And of course, we want those subject matter experts that we've picked to go out and train and pilot with these employees, that they help promote the new system to show that it's a positive for the company, and that those small wins will build upon the change that we need for the rest of the hospital. And then the second aspect is that we're making a big change for the hospital. We also want to make sure we're promoting it with the patients, how our care will be better for them, how our data and information and future prescriptions of drugs and handling of that will be better for them. So we also want to get the feedback from the patients and help promote the new system. Lastly, one of the key aspects of any new software change in a company we should all know is training. So after the small pilots are used, we will need training across the hospital. So in aspect, we need to create more smaller subject matter experts in each department so that we have even another level of support below our top level subject matter experts. We need to ensure that doctors and nurses alike understand what the system is telling them. And then we need to ensure the patients understand what the new system will be tracking for them. This training is extremely important so that the doctors, nurses, and employees of this hospital feel comfortable using this system so that there will be less mistakes. And the training aspect is important so that we can fully utilize the system and not mismanagement because we didn't train well. And so at the end of the day, we as a management group need to make Springfield the general leader in the industry with this new technology. And I want to make sure that new technology is always great, but it's only going to be as good as the time we invest in it and the training we invest in it to make sure that it's used properly. So thank you, and if you have any questions, now's the time to ask.